Hi, everybody. Thank you very much for the invitation, and thank you because you made such an introduction, and I'm going really, it's like we rehearsed before. So we often say, and that what you were putting on the pentagram of change, that health is a political choice, and that will be what I'm talking about. Just to see urban WHO healthy city exists since 30 years, not that many networks exist for that long. They've got we have 1,500 cities in 29 national networks, probably 30 soon, which is a lot. The director of Euro gave us 20,000 cities by 2020 as a goal. We also shared in Astana, in the Primary Healthcare Conference, the goal of having 20,000 healthy cities, WHO healthy city, in each region by 2030. And I think it's a great goal. I think it's a great movement. I'll present deeper. And I think we're very bad at communication because people don't know it that much, because you're quoting healthy aging, which is actually kind of a spin-off of Healthy City, with 33 cities, and we have many cities, and we are doing amazing things. This is the French network. We had, when I got elected as deputy mayor in 2014, we had 86 members. Now we have 95. I think before the end of the year, we'll get 200, and we doubled the budget. It's working. We are having a momentum in urban health. That's also why we're here. It is working. We are doing great things. Why WHO Healthy City? Because we do not sprinkle. We do not take the diseases. We take the global vision. And to leave no one behind, probably you're familiar with the two first picture on equity. Like equality, you give the same box to everyone. Well, that doesn't work for the most vulnerable one. The second one is equity. You give two boxes to the most vulnerable person so he can see, and the not vulnerable person doesn't need a box. But in a healthy city, we can go forward, we can go further. In an ideal way, in a optimistic way, we take off what's the obstacle. We take off the obstacle so everyone can benefit from the same good condition for health. An example is clean air. So health is a political choice, but what is a political choice? And when you don't have Ricardo as a health mayor in your city, how do you do? So I use comic a lot also. So you have the theory, Ricardo show, so you get to be elected and you see the health determinant because your people on the university in your city, in the best case, are training you. But in real life, it more looks like that. So this is the obesity system influence diagram, and I think it's a great one to show it's not that simple. And we need to understand that. And we need local data. I'll go back to there, but the day I could get budget is the day I could make an observatory and show to the people, to my colleagues and the mayor, that, yeah, we have 3% of child obesity in my city. Like, ooh, we're world winner, right? But some neighborhood, we have 12%. And it's not because poor people don't know how to read health prescription, right? It's because it's very complex. So we could focus all our obesity actions, not in the neighborhoods where we have 0.2% of obesity, but in the neighborhood where we have 12% of obesity. This is health in all policy theory. Because we get everybody around the table and say to the culture people, what about integrating mental health issues in culture? We talk about the economy, we talk about innovation and urban planning, and this is great. This is what I do in real life. So this is health sector in the organigram of my city, and I go to talk to all of them. And for some of them, it works very well. And I'm always framing it in win-win strategy. I'm always framing so that they get the benefit. I don't want to get the benefit. I'm public health. We don't do that. We want them to get the benefit. And I want the urban planner to say, oh, we're the first city in France to have health in our urban planning. Yeah, good. Good for him. And sometimes it doesn't work. The sport person in my city doesn't want to talk about health. His policy is about health and competition. Okay, we did some things, but it was not a success. So we have to choose. Some things are good, some things are not working. It's windows of opportunity. But the more I go to all the meetings of my colleagues, the more, instead of getting people in my room, the more I go to everybody's room, the more I've got success, the more I'm training people, the more I'm getting them to understand what are health issues. So we made a study. I'm very lucky because in my city, Rennes, in the west of France, the metropolis of 450,000 inhabitants, we have the National Public Health School. So I work a lot with them, and we made a study to see how politicians take decisions. Because lots of academics think politicians take evidence-based decisions. Well, sorry, no. Sometime, maybe. When the evidence is readable, I've got 70,000 students in my city. We have lots of theses. I cannot read them all. I really cannot read 1,000 pages thesis every year, unless 80,000 pages, So we need good evidence. But we also take decisions based, and I talked about it yesterday, on public opinion. In local competition, sometimes I got some budget saying that the big city in the west of France is doing it, and we have to do it before they do it. On economical interest, of course, on medias. Sometimes we get a decision because one citizen asks a question to the mayor in a very big public meeting, and then she comes back to you and says, "Hey, Charlotte, do something about that." This is not even the best. This is public opinion based, and that's not bad or good. This is how it goes. And once we know how it goes, we can change it. If we don't accept that, we cannot change it. It's, of course, based on values, ID, and political interests, yet I really think health is something that gets people together. Our networks, one of my vice presidents is from left wing, and one of my vice presidents is from right wing. That gives that big weight on advocacy and national advocacy, because health is a common and public good. And then, of course, social movement and personal experience. I met mayors saying, "Oh, I'm doing lots of things for the pink cancer, breast cancer thing because my stepsister had a breast cancer." Well, I think Pink October is not a public health policy, but we've got to see why people are doing that. I think it's a part of it. It's not just it. So why WHO Healthy City Network is so strong? Because it's changing that. We are empowering healthy city mayors. We are using the convening power of the mayor because we have this convening power. We can get people around in the table, and we can influence public opinion, local competition, everything with evidence-based research and good communication. So what we do, mostly very simple, is gather with a convening power, empower with good training and adapted research tools, and deliver as one. Yes, we get everybody in the room, so we have one message on health and well-being. We don't have so many messages that at the end you don't know what to do. If you're having a baby in France, the first bath of your baby, you have 70 instructions. I don't know how you can, you just... So then you don't know what's important. And you see pregnant women saying, "Oh, I cannot eat sushi, I cannot drink alcohol, all that is bullshit." Well, some of it is more important. So we need evidence, we need health literacy, and we can do that. So we empower politicians. So with comics, I'm finishing my mandate, so I'm also really willing to transmit and give tools to the next one, because I won't run again, not this time at least. So we're making maps, city maps, with health determinants to show how it works. I've got some of them, really easy to use. And then I've got one data, why is urban planning good for health, and 3 examples, very simple things. And then you can go further. We are doing a MOOC, we are doing lots of very hands-on material. We have 4 pages briefing papers, like healthy urban planning, some of it is translated. And to have the stakeholders, you can bring it to your colleague's room. It's really easy. You've got 1 page of evidence, 2 pages of example, and 1 page if you want to know more about it. We empower communities. And as Ricardo said, we cannot do anything without communities. Moreover, we are good people for health. We are global actors because we know the people, because we know that not everybody knows how to ride a bicycle, because we have the reality of the poorer neighborhood that sometimes at national government they don't know. So for instance, this is something we did in my city for air pollution. We gave in 2015, it was the first city in France and one of the first in the world with Barcelona. We gave air quality sensor to the people. But what we did is we gave it in priority neighborhood. And we used it as health literacy, as digital empowerment, as making the people proud of the neighborhood. And more than anything, we did it so that they bring solutions, so that they monitor the air pollution and that they say, this is what I need to change. Because I can't say to everybody, ride a bicycle, don't take your bike. They say, okay, but I cannot do that. So my job is to say, okay, what do you need to do that? What is your need? And this is working. This is really working. We've been improving air quality in the city a lot. We also want to develop win-win strategies. And for instance, we made a plan for healthy food in the city. But we had a big issue between two colleagues. One, she's Green Party, she was saying, oh, it's good for child health. And the other one is a doctor, a physician, who said, I've got no proof. There is no evidence that eating organic is better for child health. And that was true back then. But when we make a political choice, it's saying, okay, we don't have proof for that, but we have proof it's better for farmers' health. Oh, yes, we have proof for that. It's better for the water protection. Oh, yes, and we hold the water now. So it's the city doing the water. So we made special contract with the agriculture to make organic food for the school in the schools, the food in the schools, and so that they protect the water, and we give them money, and we created lots of agriculture, filière. I don't know how to say that, but they could grow, economically speaking, because they were protecting the environment, and we were getting them money to feed the kids in the school. So it's good for waste management, and we also had a national call for action, and so we had a prize from the Prime Minister, which was also really good. We have lots of national and international advocacy, and what we do, you talked about the media, we have lots of things. We created a book on inequities and childs. And we made a paper that we had signed, not by the vice mayor, but by the mayors. And we had the mayors of 18 big cities in France signing, and I called the newspaper, and we had it in exclusivity on the national newspaper. Well, I had meetings with all the governments that never had us before. So it's really, how do we make advocacy? How do we use the convening power of mayor to have good advocacy for public health and make it national, make it a national debate, and take it. It was not about health, it was about kids. It was not only about public health, it was about inequity and childhood, and it worked. We also have innovation, and Gordon here was there. Back in the COP21, we met a Brace Your City hackathon, getting innovators with public stakeholders and trying to see what we have in common and how we can work together. And that was really successful. We want to go on trying to see how innovation can adapt to our issues, to our equity issues, and to our monitoring issues, and not only to make a product to sell. So very quickly, I wanted to go to an example of how we integrate health in the renovation of a deprived neighborhood in my city. So you see, we have lots of green spaces. We have a city we are almost to 50 square meters of green space per person. Yet this is neighborhood built in the 60s and very deprived, and now we raise lots of money to improve it. But we wanted to map the need. I won't go back. Ricardo told about how do we get real good data to see what are the stakes. So this is the neighborhood on this one. So this is where we have the highest premature mortality in the city. This is where we have also obesity, that we have problems with gender equities, with mental health issue and all of that. So we have good data for that. We needed also to come from the community and see the uses. So this is a map done by the children of the city, of the neighborhood, seeing what do they know of the neighborhood, what do they know of the rest of the city. And we worked a lot with the elder, with the young, to see how they see the neighborhood and really adapt the renovation to the uses of the inhabitants and not to the gesture of an architect, because sometimes we really do bad things in cities because we don't begin with the uses of the people. We mapped the actors. This is all the people acting on the renovation. And we really need to see who are those people from the green spaces, the architects, the people from private sector, of course, the people from the housing sector, from the public equipment, the people that are going to make the streets and the people that are going to make well, everything. We also analyze some very specific things. We went to see all the parks where the kids are playing, and we analyzed how they are good for physical activity for the kids or not. And then from that, we made a recommendation to see how you will make good public spaces for physical activity. We made a recommendation for the school, because we make a new school, and which was great, but it was really near a very active road where we have 10,000 cars a day. So we made all the architecture so the school will not have the air pollution. We also made a patio for the kids that will not be the boys in the middle playing soccer and the girls around. So really taking into account gender equity. This is also about health. And the recommendation we make, we spread them to the city and we scale them up to the network. So, at the conclusion, healthy city, it's a global vision. It's not sprinkling a little bit of it, a little bit of that. It's always a global vision. It's an ecosystem that addresses complexity because there is no simple solution. And at the same time, I think that cities are going to save the world for climate change and for all the things that are coming up to you from all the obstacles. If we can have resilient city, if we have empowered politicians locally that can empower community, then we can do something. With scientific evidence, with example, support. I can call so many mayors in the world to say, oh, I remember you did that. How did you do that? Can you help me for that? So the network is used. We have a bigger picture. We think forward. We think sustainable policy in the long term, and that's really useful. And adapt it to local data. I need local data. I need data at the street level. And this is where also we need the private sector. And this is a great comic. It's Ben Cave, and it's called Health Girl, and I love her. And the whole comic is really good on how to make health in all policy. And I think that's what we do. We empower champions. We need ambition. We need to have 20,000 healthy cities in each WHO region. We need WHO Healthy City to be the global umbrella with Diabetes City, with Better Heart City, with all of them, because 20 cities is not enough. We need much more, and we need to act together and deliver as one, so we really have an impact. Thank you.